My honor to be with you guys today. Thank you for taking the time off for this next hour to learn about this, knowing the signs of someone that's struggling with mental health. So I'm going to go ahead and share my screen with you all. Give me 1 second while I share with you my screen and go into full screen mode for everyone. So I work at the LightHouse Arabia. We are a mental health and wellness center down in Sakim, Jumeirah area. And we are about 30 clinicians, psychologists, and psychiatrists who are here to help you guys. We work from prenatal ages up to couples and family therapy. All of our clinicians have different backgrounds in psychology. We come from different nationalities, so I'm sure that there's going to be a match for you all. In today's talk, I really want to emphasize the importance of our mental health. We all have mental health just like we have physical health. So in that sense, I strongly suggest all of you who are on the fence in psychology or don't really know a lot about psychology, have a 30-minute checkup with one of our clinicians once a year, once every 6 months, just like you would go to the doctor and see if you have high blood pressure, high sugar levels. You go to a clinician and you find out how your overall well-being is doing. That clinician might say, you know what, you're on track, you're ready to go home, you're doing a great job. Or that clinician might say, look, Daniela, I think there might be an area in which you're struggling with, therefore I'm going to suggest A, B, and C. So this is something that we have that is going to be useful for those that are on the fence about therapy or don't know a lot about psychology. You call up the Lighthouse and just ask for a mental health checkup to be done. All right. All right, so let's get started for today's topic. So why does this matter now? You know, why is this important at this point in time? And the thing is that we have been living in a year of so many unprecedented situations, right? We are ever more losing our control of our life. We don't necessarily know what's going to happen tomorrow. Our life from one day to another has shifted. And therefore, this the identifying of someone that is hurting or someone that is struggling is going to be key. You're going to realize throughout the presentation that it's not the typical symptoms that we would necessarily know about that tells us if someone's struggling or not. So our mental health is something that we need to care for. We need to understand what it is, and we need to come to terms with the fact that we are always going to have it, and we're going to see it as a continuum. And I'm going to explain this a little bit later, where you're going to understand what low mental health looks like and what a high, strong mental health looks like. But at the end, we all have it. We all go through it. We all thrive with it, and we all struggle with it at some point. We're also going to recognize the difference between healthy sadness and depression, as well as healthy worry and anxiety. Now, I want you to notice that I used healthy sadness and healthy worry. All of our feelings are actually necessary. These are our ways in which we are communicating with the external world. This is the way that we understand when something's a little off, when we understand what we necessarily need in that moment. But having sad days, having worried days is normal, and it's expected. It's part of our life. That's why we're human, because we feel differently from animals. So healthy sadness and healthy worry are going to be part of our daily lives, but we want to make sure we're differentiating it with what we're going to call a major depressive disorder or an anxiety disorder. And how to respond to someone that is struggling. What do I say to that person? How do I help them? And where can I actually refer that person to go when they don't want help? So the truth is that mental health struggles is actually more common than we think. 1 out of 4 people are struggling with a mental health disorder. Imagine, we can be in a room with 10 people and 2 of those people might be struggling with a mental health disorder that we don't even know about, or they might not even know about. It doesn't discriminate age, it doesn't discriminate gender, it doesn't discriminate religion, it doesn't matter what part of the world we're in. Mental health affects all of us because we all have it. And something that really struck me when I was doing research to put this presentation together is that every 40 seconds, someone dies by suicide. Imagine every 40 seconds, someone did not get the right help, did not get the right support, and therefore died by suicide. And this is a huge, huge impact in our society because it is depression is the second most common illness after, I think, is heart failure. And we're not giving it importance. So it is actually the world's biggest cause of disability in the workforce, and we're still not giving it importance. People are taking leave of absence like crazy in the US and Europe here because they feel depressed, and yet we're not giving it enough importance. We're not being able to recognize it as something that is real, that is a struggle to a lot of us. So I just want you to take a moment, look at the slide and realize this is real. This is something that a lot of us are struggling with, and unfortunately we don't have the resources or we don't know how to help. So this is why I am very passionate about this talk with you guys today. So what is mental health? We all have it. That's something that we talked about earlier. It is important for your overall health. It is not people going crazy. It is not something for the weak. It is not the same as a mental illness. And that's something we tend to confuse quite a bit, right? Because mental health is quite a dirty word. We associate mental with crazy, with dangerous, with weak, with struggle, with inappropriate, and you can think of any other names that you can maybe relate the word mental with, but they're not positive at the end of the day. We don't relate it to a normal part of our life. So we want to make sure that we are defining mental health as the health of our mind, therefore our thoughts, and therefore our feelings. That is what mental health is all about. How am I taking care of what's going on here? We take care of what's going on in our body when we go to the doctor, right? So why are we not taking care of our mind? Because our mind is just as important, and it does struggle and it is vulnerable in certain contexts, like the year of COVID, for example. So it's not about feeling good all the time. And sometimes I have to say to you all, I get clients that come to me and say, you know what, Daniela, I just want to be happy. And my answer to those clients is, I'm really sorry. I am not here to make you happy. Because life is not only about happiness. It is about sadness and worry and frustration and feeling upset as feelings that come and go and that are normal to have. But unfortunately, so in a society of seeing sadness as a struggle or seeing worry as a negative feeling, we want to do everything we can to avoid it. And this is where a lot of our depression and anxiety disorders come from. The avoidance of our feelings and the suppression of some of our feelings instead of acknowledging them and understanding what they're there to do and why we need them. So it is not a fixed state. It fluctuates on a daily basis, on a minute-to-minute basis. And that doesn't mean we're bipolar. It doesn't mean we're struggling. It just means we have mental health. So let's look at what good mental health looks like. So for example, take the example of Johnson. Johnson is a 34-year-old male who has a job, who exercises, who's connecting with people, who's playful on the weekends, who has time for himself, for his family, is having positive thoughts about life, hopeful about life. Therefore, he's in the spectrum of good mental health. However, Johnson is going through the year of COVID. He lost his job. He hasn't worked out. He's been struggling with his wife. He's been having negative thoughts about himself and others. And therefore, that mental health spectrum will then move to the poor mental health bit of the continuum, right? So Johnson, who seemed to be great, not struggling at first, a few months pass and he's then going into the poor mental health part of the spectrum. And that's okay. However, when we notice that Johnson has been struggling for a few weeks and he hasn't been able to overcome these feelings and these negative thoughts keep on impacting his life, then this is where we can begin to have a bit of concern and we need to follow up with Johnson. So when we are defining what a mental health illness looks like, or how we can differ from the healthy sadness and the healthy worry versus the anxiety disorder and depression disorder, we need to think about these following things. How is Johnson changed from where he was to where he is right now? Has there been significant change in his behavior, in his thought process, in his feelings? How long has it been since Johnson has felt this way? So the duration is going to be important. The impact is going to be important. How are these thoughts and feelings impacting his daily life? Is he not able to socialize like before? Is he not able to engage in physical exercise for a prolonged period of time like before? Is he increasing his food intake more than before? Is it interrupting his life at essence? Now, we are not going to be diagnosing everyone after this chat, after this webinar. This is just for your reference to identify if someone might be struggling. We are not going to label them. We're not going to give them a diagnosis. That only needs to be done by a clinician who has expertise in assessing and having the clinical intervention. But this is for you to understand, okay, what do I need to keep my eye on when someone starts to look like they're struggling a little bit? So we think that mental health initially, a lot of us thought that mental health looked like Eeyore. I'm not sure if you're familiar with Eeyore. He's a character of Winnie the Pooh with always a gray cloud over his head, and he was talking softly and having negative thoughts, and he would always say things like, good morning. Oh, wait, I don't know how good this morning would be. And, all this, low tone of voice, lack of visual contact, just overall negativity. And then we have Van Gogh's picture on the other side, which, by the way, was a picture that was drawn 2 months prior of him dying by suicide, where he's struggling, he's not looking up, the colors of the picture are quite dull, he's not necessarily, smiling, you can't see his face, so the body language is quite telling. But the truth is that mental health doesn't always look like this. It could, but it doesn't always look like this. We're in the world where there's a lot of pressure, a lot of expectation. So actually mental health looks like this. Mental health illnesses look like this. So you might see the overachieving, the famous, Michael Phelps, Dwayne Johnson, Princess Diana. These are Martin Luther King. These are characters that were on the spotlight, that came out and were open about their mental illnesses. So Martin Luther King actually had 2 suicide attempts in his teenage years because he was suffering with depression. Princess Diana struggled with an eating disorder. Michael Phelps also thought about taking his life and struggled with anxiety. Dwayne Johnson, you see this big, bulky guy in Hollywood movies, funny guy, caring, again, struggling with depression. Elon Musk, CEO of Tesla, again, struggling with anxiety. And this is not healthy anxiety or healthy sadness. These are diagnosed disorders where they are in the poor end of mental health spectrum. So what we see in our daily lives are masks, right? We put on a front so people don't know how we're feeling. we try to move on, to suppress our feelings. And I like always saying, whatever we resist will persist. So every time we're trying to hide our emotions, we're making our emotions larger and more out of our control. So in the image on the other side is really how these people feel, right? They're coming up as social, they're coming up as happy, but inside there's an internal suffering that is out of our reach, that we can't see. So our mind and our body are going to be connected. So sometimes you might see someone with bags underneath their eyes, or looking a bit tired, or looking a bit slim. And that's actually another sign for us who are trying to see if someone's struggling. Wow, how is that different from the Daniela I saw 2 weeks ago? Is it something that's going on for her? I'm seeing her more tired. Her light is not there anymore. Her energy isn't there. And by the way, I tend to be quite energetic at work and quite spot on. But when my mental health is on the lower end of the spectrum, people start noticing when I am maybe not as energetic. There's no other difference than that. I'm not as energetic. I'm not as talkative. But someone that knows me will then spot that and say, something's off. She's not being her usual self. And maybe they will ask me if something's going on. But we know that 2 out of 3 people actually will never seek treatment. 2 out of 3. That's a big number, because there is a stigma around mental health. What will my parents think if I ask to go to a therapist? What will my friends think if they know I'm going to see someone for help? Is that going to make me look weak? Am I not strong enough to carry on with my feelings? I should be able to control this. Why is this getting so hard? I better hide my struggle. So depression worsens pain symptoms because our body and our mind are connected. So if you're having depressive symptoms, then all of your muscles and all of your physical health is also going to go down with it. We know that people that struggle with depression live less. We know that people that struggle with depression suffer from immune disease. We know that people that suffer from depression have more prone of having any sort of physical, at the end, any physical struggle. So this is a real important factor for us to give to mental health. So what do we want? We want early detection and intervention. Why? Because right now it is not enough for governments to invest money in treatment. Because when we're in treatment, it's very expensive. It's very, we don't know how long it's going to take for that person to recover, because it depends on everyone's context. So the best part of helping, the destigmatization of mental health is actually by early detection and intervention. Why is this? We will have shorter treatments required. We will have less of a negative impact on that person's health. We will have a fuller and more of a long-lasting recovery. We will be increasing self-esteem and motivation. Likely, you won't have the more likelihood of losing your job, because you have a confidence, you are feeling better, you have higher self-esteem. So all of these things are going to be impacted by your mental health. You are going to have decreased risk of serious impairment or suicide, which are the things that I explained earlier, where there was such a high number of suicide every 40 seconds. So early detection is key. And apart from that, we know that most of the mental health illnesses start by the age of 14, 12, 14 years old. So imagine if we can start helping our children, our teens, develop coping skills and problem-solving skills, and boost their self-esteem and give them resources to cope with these uncomfortable feelings and thoughts, then more likely we will be able to not have to invest in the treatment part of things and just focus on the preventative measures that are needed. So let's start recognizing some of the risk factors. And risk factors are really important to recognize in someone that might not even be showing you the symptoms of a depression that we're going to talk about later, but they're just factors that we need to keep our eyes open to. So biologically, there are certain things that make you be more predisposed to mental health illnesses. So for example, if your family has a history of mental health illnesses, of depression, anxiety, probably you will be predisposed of being vulnerable for a mental health illness, right? So by default, okay, if that's my history, there's nothing wrong with that. How do I take care of myself? I need to really invest more time and energy in protecting myself from developing something similar. If there have been history of immune diseases, also, let's take care of our mental health. It makes you be more predisposed to mental health illnesses. So biologically, these two things are going to play a role. Now, psychologically, what are the risk factors there? If I know someone's having poor self-esteem, not thinking great about themselves, tend to have lots of negative thoughts, just worry thoughts in their family, they're worriers, what we call the worrier type. Okay, we want to keep an eye on them. Someone that has struggled maybe with a loss, someone has died in their family, they're going through a divorce, they're changing countries. These sort of adjustments and grieving processes also make us more vulnerable in developing a mental health illness. So these are times where we need to, put our alarm system and say, okay, wow, that person is at risk. What do they need? What can I suggest them to do to take care of themselves? Socially, for example, bullying situations, not having a social support system, feeling betrayed by someone, having a toxic family member, toxic friendships, being in a marriage where there's a lot of codependency, a lot of aggression, invalidation, lack of empathy. That's going to play a really important role. And all of us, most of us are expats, right, in Dubai. So as an expat, there's actually a higher risk of developing mental health illnesses because we don't have our home. We're far away, far removed from our family members, our core family members. We feel far away from our family. And that's going to make us feel more vulnerable. So therefore, as expats, we all need to really be mindful of how this can be a predisposition of developing a mental health illness, which will then require more of self-care routines. All right, so now let's look at what is depression and anxiety. What is the difference between sadness, healthy sadness, and healthy worry? All right, so the symptoms and signs of depression, we need to look at time, right? We talked about duration, intensity, and impact. So in terms of duration, we want to make sure that it has been for 2 weeks at least that we have seen the following symptoms. Now, it can be not only one symptom will tell that that person is depressed. We need to have 5 out of the 9 symptoms that are written here, okay? 5 out of the 9 consistently over a period of time. So lack of interest in pleasurable activities that they used to enjoy doing. So someone that enjoyed swimming is not swimming anymore. Someone that enjoyed cooking isn't cooking anymore. Being tearful most of the day, every day for 2 weeks. For kids, I want to say that's not a symptom. For children or teens, usually it's irritability that we see instead of being tearful. Lack of energy or tiredness, difficulty concentrating and making decisions. So someone that feels or looks flustered all the time, confused, moving slowly or the contrary, becoming very agitated and unable to settle. Changes in sleep, that can mean sleeping way more or sleeping way less, whatever that, in comparison to whatever that person used to sleep. Changes in appetite, again, increase in appetite or decrease in appetite depending on where that person was before. Remember, we're always comparing to where they were before. Irritability, feeling worthless or guilty even though they're not their fault. I don't have anything to look forward to. I don't have a future. Everything's my fault. You must be mad because I did something wrong. I'm not worthy of your love. These sort of comments. Thinking about death or wishing they were dead, and maybe actively talking about it or showing signs of hopelessness. For kids, it might be writing stories about death. I want to say something about kids here. It's not in the presentation, but I think it's useful. A child does not have the concept of death until the age of 8 and 9. So prior to 8 and 9, if they talk about death, it is something that we need to talk about, but it shouldn't necessarily be a worry, okay? Until the age of 9, they start understanding what death means. And therefore, then we will get a little more worried if they start talking about death loosely or about not being here. So here's the main difference, right? So healthy sadness is a common human emotion. It only lasts for a few days. You're still taking pleasure in things after a few days. There's a minor changes in your thoughts and feelings and your behaviors, but overall you're okay. I mean, you have something to look forward to. And most importantly, you do not have any suicidal thoughts or behaviors. Now, in someone that's depressed, that's completely different. It will last for 2 weeks. You do not enjoy anything in life anymore. There are some major, and I want to focus on the word major, changes in your thoughts, feelings, and behaviors. There can be suicidal thoughts or behaviors around their sadness and their helplessness. There's a lot of shame and guilt that you can see and they verbalize, and it is a very serious medical condition. It is not a weakness, it is a medical condition. Just like a migraine is a medical condition, just like any other illnesses is a medical condition, so is depression. Let's go into anxiety now. Now, there are some common symptoms of anxiety that we need to look out for. It presents itself physically, psychologically, or behaviorally, or all of the above, okay? So physically, we're gonna start feeling agitated, tight chest, fast heartbeat, dizziness, shortness of breath, sweating, numbness, concentration problem, muscle aches, restlessness. You're gonna start seeing that that person's not him or herself. Psychologically speaking, there's also a lot of symptoms there. Racing thoughts, your mind's going blank, you're not able to concentrate, you're indecisive, you're becoming irritable, impatient, angry. Anger is actually a really important emotion here to highlight because usually it works in like an iceberg. The top of the iceberg is anger, and underneath anger, there's so many more emotions that are not seen. Anger is quite easy to express because it keeps people away, and it's actually a defense mechanism for a lot of us. But underneath anger, there's feelings of hopelessness, fear, overwhelmness, anxiety. So it's important to watch out for anger. Confusion may be, feeling on edge all the time. These are just some of the psychological symptoms that we want to be mindful of. Now, behaviorally, we might see that person avoid situations or avoid people that they weren't avoiding before. So if I'm growing anxious about eating, then I might avoid social settings where there's food. Or if I'm fearful of social interactions, then I might avoid going to parties and I'm just gonna stay at home more and make excuses as to why I'm not going out. We might start developing obsessive and compulsive behaviors, so obsessive thoughts about something and engaging in safety behaviors to reassure yourself that you're fine. Or the contrary, where you're numbing those feelings because they're so intense through alcohol and drugs. So part of what defines anxiety disorders is we have excessive nervousness, fear and apprehension, okay? And I mean excessive. That's all you can think about. It really impairs the functionality of your life. You're not able to function the same way. It also alters how you process emotions. Like I said, you become irritable, you're more erratic, you're indecisive, you're not yourself. And it is felt physically. Our mind and bodies are connected. So these thoughts and feelings also reflect in a physical manner, and we need to watch out for that. Mild anxiety it's vague, it's unsettling. You don't necessarily see it that much. And now we want to talk about high functioning anxiety. Now that's actually the hardest one to actually point out. These are people that are very high achievers, perfectionists, that have a to-do list, that have 60 or 500 things at the same time, are always on top of things. And these are the hardest ones to spot, because they're always on time, they're doing everything that they need to, and it seems like they're not struggling. But be mindful of these people, because those are the ones that are struggling internally the most, with most racing thoughts, most unsettling physical symptoms happening to them. So high functioning anxiety is a real thing. So make sure we're spotting those far in advance. So again, healthy worry, again, like healthy sadness, is an adaptive human emotion. It gets triggered by a specific event, and when that event passes, then everything's gone. It's temporary. There's some minor changes in your thoughts, feelings, and behaviors, nothing too drastic, no suicidal thoughts or behaviors. And it can be also brought upon an adjustment period, a change, a move, a divorce, something that's happening out of the ordinary. Now, clinical anxiety is a serious medical condition, and it's not necessarily triggered by something. It might, but it's very long lasting. And when that event has ended, it continues. There's some major changes in your thoughts, feelings, and behaviors. There might be some suicidal thoughts and behaviors that we need to, worry about here. And again, like depression, there's shame, guilt, and hopelessness. In psychology, we always see depression and anxiety as sister disorders, or we like to say comorbid disorders. They usually happen simultaneously, or they might develop into the other through time. So they usually are quite linked. Now that we've had this crazy year in the past, 10 months, there's some signs that we want to look after. Okay, so changes in appearance, hygiene, or weight. The environment of that person becomes chaotic. They're not cleaning after themselves. It's getting dirtier. Lack of responsiveness, over responsiveness sometimes, where they're putting so much pressure on themselves. You're making a lot of mistakes. There's a lot of gloomy attitude. You're wearing your pajamas into the day. You're not changing. You're not showering. You talk about not being well. You are not engaging socially as before. Maybe sending messages at odd times where you think that person should be sleeping, but they're not. These are just signs to be mindful of during this time specifically that are COVID related. So how are we going to be safeguarding mental health? So we need to start engaging in our emotional hygiene. What does that look like? And they're little things, guys, that make a huge difference. Huge difference. There is a book I want you all to please read at some point. It's called Why We Sleep. It is an amazing book where it talks about the importance of your sleep patterns, sleep hygiene, what are the consequences of lack of sleep, what are the benefits of sleep, and I could go on for 2 hours talking about sleep because it's such an important part of our lives. So adequate sleep, exercise, water, nutrition, these are basic things that if we put our mind to it, we can create great shields for our mental health. Paying attention and being curious of your emotions. What is my pain telling me? Why do I care so much? What is going on in me? And if you don't know, it's fine. Let's go talk to a therapist. We can talk it out and find out the reason why is it that you're struggling so much. It's okay not to know. That's why there's trained professionals that can help that person work through their own struggling emotions. Am I speaking to myself in the way I would speak to someone I love or respect? Get curious. We tend to be quite judgmental instead of coming from a curious stance when we are feeling hurt and when we're feeling low. Now, part of the problem when we are talking about emotional hygiene is that we do not know enough feeling vocabulary. Our feeling literacy is quite low. We know about maybe 3 or 4 feelings that we go back and forth and saying we feel. But the truth is that we feel so many ways. And each way that we recognize we feel has a different physical reaction, has a different thought attached to it, a different behavior. So a lot of times I ask my clients, how are you feeling today? And they're like, bad. Well, number one, bad is a very common word to use, but it's not necessarily an emotion. Is it bored? Is it busy? Is it stressed? Is it rushed? Is it overwhelmed? Is it sleepy, indifferent? What is it? So maybe taking a screenshot of this would be important, or looking up in Google, the feeling wheel is going to be important. In this way, you're going to have more options. And when you name the feeling, you feel a little more in control. You're feeling like, oh, okay, I'm recognizing that. It's important. What am I going to do about it? What is it telling me that's going on around me that I'm not necessarily feeling comfortable with? And you are giving your permission to feel. Another book I suggest is called Permission to Feel. It's going to teach you how to let your feelings be. Come from a curious stance, understanding in your body where you're feeling it. Going back to maybe who passed on these rigid rules about how life should function, and therefore making me feel flustered and overwhelmed about the current situation. Who passed on all of these high expectations in me? Because that's what's making me struggle right now. And where do I feel that? These are just questions that are coming from a curious stance, again, that are going to make you feel like you're leaning towards your emotions instead of running away from them. Whatever we resist will persist. So the more we want to avoid and put our emotions under the carpet, the more they're going to be there and the bigger they get. So we want to stay focused on the little things we can control. Again, taking day by day as a different challenge. Every minute is going to bring me a different need that I might have. Limit your intake of news. It is very highly unintuitive to limit your intake of news, because the more we look at the news, the more control we feel. But the truth is that the more focus we're giving the negative feeling, and therefore the more overwhelmed and hopeless we're going to feel. So limit news intake, please. And if you can't, then just focus on maybe a 1 hour a day where you are only focusing on local news, or maybe one international news, but only for a limited period of time. And please don't do this at the beginning of the day or before you go to bed, because these are times that we need to protect for ourselves, that we need to engage with our mental health, rather than being able to just soak in all the negativity that is out there. Asking yourself, how are you feeling today, Daniela? I'm feeling overwhelmed. I feel like I have a lot to do today. What would you need, Daniela? I feel like I need a break. Okay, let's take a 1-minute breather. And then you can start your day. Check in with yourself. We never do that, guys. Never, ever do that. And it's so useful. How do we check in with ourselves? We can practice mindfulness. We can practice breathing exercises, imagery exercises. There's so many apps out there that are going to be useful. One that I really like is called Breathe Work. I really like this app. It gives you different rhythms of breaths that you can take, and really just regulates your physical responses. Again, it's called Breathe Work. I really like that one. Stay connected to people that give you that positivity, that give you the energy that you need. And also, again, I encourage you all to have this 30-minute check-in with a therapist just to see how you're doing. All right, so how do we respond? We have identified someone struggling. We know the symptoms. We know that this is not healthy anxiety or healthy sadness. So what to do? This is the big question. So there's the 3 C's that I want you to remember. By the way, this webinar is going to be recorded, so you will have this information with you. So the 3 C's is check in with that person. First of all, remember, where am I? Is this a private place that I can reach out to that person in? Is that person in the mental capacity to hear me out, to check in with them? Empathize. We aren't very good at empathizing with people. Even though we think we are, we're not very good at it because we try to problem solve. When someone is struggling, rarely do we not jump into problem solving mode because we, deep inside of us, don't want to carry that person's negative emotions. So if someone says, Daniela, I'm struggling, my immediate reaction is going to be, well, have you tried this? Why don't you do this? Have you considered doing that? Oh, don't worry, everything's going to be fine. So we feel like we have to respond with some solution, but rarely does that work. Rarely does that work. We need to start empathizing with, and how does that feel like for you? And how long have you been struggling with these feelings? What sort of thoughts are associated with these feelings? Is it getting harder to do all the things that you have done in the last few months? Are you connecting with someone? So you're coming from a curious stance. If you don't know what to say, which is fine, a lot of us don't know what to say when someone's struggling, it's better to say, wow, I don't even know what to say right now, but I'm so thankful that you're telling me. Or, wow, I really feel for you. Thank you so much for sharing this with me. So you're there in that moment with that other person's emotions. You're not trying to invalidate them. You're not trying to push those emotions away. You're holding the moment for them. And that's going to make a huge difference. And lastly, we are going to clarify the information. So you might say, have you tried reaching out for help? Has anything helped? And you might say, okay, well, listen, sometimes it's better to talk to a professional about this. Have you ever thought about reaching out to a professional? No, I haven't. Okay, well, I might have a person that can help you if you're ready for that. You just let me know. You're not imposing help on them. You're not forcing them to follow your advice or go with a doctor that you know will help them. You're just letting them know that there might be some information that you can give them, some books that you can recommend, blogs that you can recommend, a center that can help them, and that's it. The 3 C's. All right, I think I've explained this. So you're gathering your data points when you're asking the questions. You're trying to see what symptoms that you know from depression and anxiety are present, trying to find the right time and platform. And I want to say something about the check-in. You have to check in with yourself first. If you're overwhelmed yourself, if you're not in the mental capacity to check in with someone, don't do it, because that's not going to go well. It's not going to go well. So you are your own priority. Think about airplanes. You put on your mask first before you help others. The same happens here. I explained this already, how to respond empathetically. You're not problem solving. You're just trying to see what the issue is. These are some suggestions that are going to be useful. So you can see how the questions are coming from a curious stance. Tell me more. How long have you been feeling this way? Have you ever experienced something like this before? What can I do to help? What do you think will be the right thing to do right now? Please screenshot this slide if you need to, so you can have some ideas on how to respond. We're not going to be judgmental or invalidate what they're feeling with things like, at least you have a house, at least you have a job, at least you get paid, or stay positive. It's all in your head. Be thankful for what you have. These are things we don't want to hear when we're struggling. We really don't, and it's going to drive you away from that person. All right, I've explained this. We're not trying to convince them or force them. Just make sure that they have the right information from you and you're able to know where you're going to guide them. People that you can send them to. If they're not open to seeing a psychologist or a psychiatrist, please start with a GP. GPs are going to be in charge of doing referrals. I know here, because of insurance and because of the prices, again, it can get a bit tricky. Please check out our website. We have free support groups. We have free grief support groups as well. Just check out what we have free of cost that can also be helpful for the person that you're helping. But psychologists and psychiatrists will also be the go-tos here. if a GP is not available. And there's a lot of insurances that do cover psychological or psychiatric help. So make sure we check that out. Other people that can help. If you are a mental health first aider and you've done our course, then you know exactly how to respond to crisis and mental health illnesses. So if you in your corporation or in your surroundings know that there is a mental health first aider, go to that person as well before they seek help from a professional if they're not ready. Human resources, faith leaders, embassies, nonprofit organizations, these are just stepping stones before actually seeking professional help. If they're not ready to speak to a professional yet, then these people can definitely guide you to a professional later on. And I love this quote by Obama. It's something inside you feels it's wounded. It's just like a physical injury. You've got to get help. There's nothing weak about that. It's strong. So that is how I want to end our presentation today. And you have, now I'm going to maybe stop sharing and answer some of the questions that you've written down. So maybe I have enough time to hopefully answer all of them. I hope that this presentation is useful. Again, this webinar is being recorded and is going to be sent out to all of you. All right, there are some questions here. Do I have statistics of people who die by suicide and their faith? I'm curious what's the percentage of Muslims among them. So unfortunately, I do not have statistics about people dying by suicide and their faith, especially because in the country that we're in right now, acting upon suicidal thoughts is illegal and it's penalized. So as of now, we don't have those statistics. Now, having suicidal thoughts is not penalized, but acting upon them is. And it's really important for you all to know that. So why do we have shortness of breath? Usually it's because our breath is becoming very superficial. We're not breathing from our bellies up. We're only breathing from our chest up. That's why breathing exercises are so useful. It teaches us to really put oxygen all over our body and really learn how to do our belly breathing. That's why the shortness of breath happens when we're anxious. What is the best way to get rid of overthinking on something which we can't do anything about? So the best way of getting rid of overthinking is, I want to say, do not say don't think about it, because everything that starts with don't will persist. So actually reframing your thoughts, starting with, I notice I'm having the thought of, and then whatever thought you're having. You're putting distance away from you and the thought. You're acknowledging that it's just a thought, something that's just popping up and doesn't necessarily require an action to it. So that's a very useful way of detaching yourself from your thoughts. How effective is the meditation to reduce anxiety? It is very, very helpful because you are connecting with yourself, with the present moment. Anxiety is usually the prediction of negative outcomes, the prediction of negative emotions, whereas when you're meditating, you're grounding yourself, you're doing breathing exercises, you are refocusing on that moment where you're at. So therefore, anxiety cannot be present. So it's very, very useful. What's the best way to keep your mind calm? So there are different apps that I would suggest you using, like Breathwork, the Calm app, Breathe. Your mind is never going to be calm at Essence because you're always going to be flooded with thoughts, but it's the way that you relate to those thoughts that's going to make the biggest difference. How do I know it's clinical anxiety? I put the table in the presentation. You will have a copy of this webinar, like I said, where you can look at all the symptoms that help you decipher if it's healthy anxiety or clinical anxiety. All right, so please describe the classification of each ring in the feeling wheel. So we basically have 5 basic feelings: happiness, sadness, fear, disgust, and I want to say fear. Right now, I forgot the last one, but you're going to see in the wheel how each feeling opens up to a variety of other feelings related to that one. Now, it is very important to pinpoint exactly which feeling you're having. Again, that brings you to a sense of power. It brings you to a sense of consciousness of more control. So each basic feeling will open up an era of other feelings that are related to that one, but actually have very different physical reactions. Look it up. It's called the feelings wheel on Google. If not, you will have a copy of the webinar and you can check them out. So suggested books, I said Why We Sleep, very good book, and Permission to Feel, another really good book. Is it okay if you do breathing exercises once every 2 hours for 5 minutes? Yeah, I think that's a good way to start. I think 5 minutes might be a long time. I usually would suggest just 1 minute, a minute and a half, 2 minutes every maybe 30 minutes or every hour just to get started. So it's really not about the length of the exercise as much as it is of the recurring into the exercise, because we want to start building a habit. When we're stressed, we will not resort to breathing unless we're bringing that habit to a conscious level. All right, so how do we disengage your mind before we sleep? So please don't use your phones, don't watch TV, don't read news at night. We really want to engage in positive healthy sleep hygiene routines. So take a shower, hot shower at night, drink a tea, read, lay down, do a breathing exercise, meditate, listen to white noise, but no electronics in the bed. Make sure that your room is only the place where you're relating rest to. You're not working or eating from your bed or watching TV from your bed. This is not going to help you have a calm sleep. All right, I think I answered a lot of these questions. I have a few more. I just realized there are just two different chat boxes, one chat and one Q&A. So I'm just going through some of these other questions here. How can I have a healthy conversation with management that this needs to change when they really don't understand their role? You're right. So I think the expectations are still a bit high. And if we don't change the mindset that we're in, it's going to be really hard to adjust to the present moment. One strategy, and this is why I really like doing these webinars where line managers come, companies come, and they hear this information firsthand from clinicians, where they understand the importance of taking care of your mental health and understanding how some of these symptoms can actually get worse with a lot of expectations and not the right mindset. So for now, self-care for you is going to be ideal, and really promoting these healthy habits of eating, drinking water, healthy sleep patterns, exercise, meditating, grounding yourself. These are just things that you can do to help soothe these feelings of anxiety and depression. Responding to somebody who you suspect is anxious or depressed, is it then important to probe and ask more questions to find out what his or her feelings are based on? So yes, that's actually one of the main points at the beginning where you are checking in. You want to make sure you're getting your data points based on the symptoms that you know consist depression and anxiety. You're asking questions out of curiosity. How long have you been feeling this way? Have you been able to do the routines that you're used to be doing after you've been feeling this way? So you're assessing impact, duration, and intensity. After you've assessed these three things, you know, okay, I need to have an alarm system here. I need to actually suggest that person to seek help. I need to normalize those feelings and say, wow, I really understand why you haven't been coming to the parties lately. That anxiety feels very heavy for you. Have you talked to anyone about this? Would you want to talk to someone about this? And you normalize those feelings. Empathizing is about connecting, not problem solving. All right, everyone. I think I've answered most of your questions, if not all. So I'm just reading something about grieving, please reach out to Lighthouse. There's an amazing support groups around grief. And I think this is an important point in your life to really be mindful of your self-care, specifically when we've lost someone. We want to make sure that we are taking care of ourselves. So we have the biggest grief center in the UAE. Please reach out. All right, guys, time's up, but I really hope that this was useful. Reach out to me if you need any sort of guidance or help. I'm going to give you all my email. It is D as in dog, Salazar, SALAZAR @lighthousearabia.com. If you have any questions, please reach out. I will be more than happy to help. Have a beautiful day, and thank you so much for assisting this webinar today. Bye, everyone.